I think it is of note to see a couple of things about the pandemic as well. That the response to the pandemic, which is a real phenomenon, but you can understand the level of distrust in certain sections of the community who don't even accept that there is a real pandemic, precisely because it's being used for corruption, cronyism, and driving home of pre-planned policies, whether that's in the field of the Police, Crime and Courts Act, whether that's in the form of the Corona Bill planning legislation, or whether that's in the form of just huge amounts of money, which, under the slogan of protecting the NHS, in fact, has been doing the opposite, not going to the NHS, but leaving the NHS starved of resources and going into private sector cronies who are providing services, however poorly. And so we've seen tests, track and trace, for example, having 42 to 45 billion. That is not money that's going to the NHS. That is money that's going into the private sector to perform jobs poorly, in a poorly coordinated way with local services, at the same time as the health infrastructure, the local health infrastructure, has actually been wound up and destroyed, first by NHS 2012, and now in the face of the latest reforms, which I know Bob is going to talk to you about. And it's of note, as typifying the kind of whole approach of our serial governments towards the state, that it is a mechanism to take funds under the guise of apparently performing public service, but to take these huge amounts of funding centralized in the state and to farm it out to private capital, to the cronies of the government officials.